The Senate would repeal the individual mandate, which requires nearly all Americans to get coverage or pay a penalty. It's one of the most hated provisions in the Affordable Care Act, and Republicans have been trying to get rid of it for a long time. But while the Senate subsidies are more similar to the Obamacare ones, there are still some notable differences. The Senate bill would provide subsidies based mainly on income and cost of coverage, but also on age. The House bill would have based the subsidies largely on age and was considered a lot less generous than both Obamacare and the Senate subsidies. However, the Senate subsidies will not be as good for everyone as the Obamacare subsidies have been. Older people will end up paying a lot more for coverage under the Senate bill because their subsidies won't go as far. Like the House bill, the Senate bill would radically overhaul Medicaid. The changes to Medicaid would be huge, and a lot of people don't realize that. The Senate bill would eliminate enhanced funding for Medicaid expansion by 2021, and then ratchet down the amount of money states receive to cover low-income adults over 3 years. The plan would also curtail federal support for the overall program, which covers 70 million children, parents, elderly, and the disabled. That would force states to make up the difference, which they can't afford to do. That means that states would likely have to curtail enrollment, cut benefits, or cut provider rates. Ultimately, we'll probably see a lot fewer people covered by Medicaid over time. So what about people with pre-existing conditions? What does the Senate bill do for them? It would protect more people with pre-existing conditions than the House bill. It would not allow insurers to charge people more based on their medical histories. But one thing that it would do, which could hurt people with pre-existing conditions, is it would allow states to waive the essential health benefits provision, which requires insurers to offer comprehensive coverage. Insurers would be able to offer skimpier plans that don't provide all of the services that people who are sick need.